I'm Anne Lancastle. I am currently a GP trainee in Craigshill and Livingston, and I am about to finish my GP training at the end of next month.
My name's Lindsay Yeoman. I am a recently qualified GP and I trained in the west of Scotland.
My name's Alistair McIntyre. I'm a GP in West Calder Medical Centre. I started as a partner in April 2008 and have been here ever since.
General practice is a great speciality. You often don't know what's going to be coming through your door on a daily basis, which is fascinating. You might be seeing any speciality which you would necessarily be doing a specialism in hospital, but you'll see it in general practice.
I wanted to become a GP because I wanted to help people. I wanted to feel like I was valued and I made a difference every day when I went to work. At the top of the list kind of thing, I wanted every day not to be a chore, and I wanted to go in and enjoy my work, and I do as a GP.
What we see is not clouded by anyone else's opinion first. We see them take the history and decide what investigations are appropriate and what treatments are appropriately. There's a real sense of being there right from the start and deciding what's best for that patient.
In general practice, you get a bit of everything. You get a bit of women's health, men's health, children's health, old age health, lung disease, heart disease. You can get anything coming through your door.
It's a busy job. Sometimes the hours can be long, but when people see that you're really putting in extra work for them, helping them, they appreciate it.
During my training, you were encouraged to kind of find areas that you were interested in. My practice is one of the deep end practices in Scotland, so that means it serves some of Scotland's most deprived population.
We're just about to start training students, and it's exciting for us as doctors having students around to train them and hopefully to, I suppose, you could say, inspire a generation that general practice is good, it's exciting, it's busy, but it's extremely rewarding.
One of the key reasons I became a GP or went into my GP training was for the relationship with patients. I feel that it's so important to get to know families, to get to know backgrounds, because that impacts on presentations for people. It impacts on why they're coming along, what the real meaning behind it is, and also how their illness impacts upon their wider family.
I think the big difference we can make as GP is really holding a patient's care together. I think this is probably seen most in terminal care, where there's so many specialties involved, but often it's the GP that holds everything together. Our practice, we make a special effort for patients with palliative care to have a single doctor, a single point of contact, and I think that's a real support for family, seeing patients right through to the end of their lives.
I worked full-time for the first 6 months of my general practice training and then went on maternity leave and had my beautiful little boy. I was then able to come back and train part-time for the rest of my training programme. When I complete my training in 7 weeks now, I'm going to be starting a salaried position, which I'm really excited about. I felt that fresh out of training, that would be the best option for me. I have my set sessions a week. I know I can plan my life. I also have slightly less of the kind of administration and managerial things that the partners have, which in the future I'd like to be involved in, but right now I want to just continue working on the job.
If you like city life, there's lots of culture here. You've got lovely restaurants, lots of things to do, but as well as that, within an hour's drive, you've got gorgeous countryside. If you like walking or kind of on the water, it's fantastic.
I do feel really valued as a medical professional in Scotland. When people see that you're working hard and trying to do the best for them, I think they really appreciate it.
I feel like NHS Scotland is also very forward thinking. I feel that everyone works together for a common goal. It feels like everyone is inclusive, everyone is valued, and that's one of the main reasons why I've decided to stay in Scotland.